There are different types of TENS: conventional, acupuncture, burst, and brief intense. Now, how do you understand in which condition which mode will work the best? For which patient, which type of TENS will be the most appropriate one? Skill is not in applying the electrodes and starting the machine. That is something that anybody can do. It is in understanding the patient's complaints, identifying the cause, and accordingly deciding which machine will work the best, and in that which parameters are the most appropriate one. When it comes to TENS, every mode differs from the other based on certain characteristics. Two most important ones are pulse duration and frequency. Now, what is frequency? If I say the frequency is 100 Hz, it means that 100 impulses are going to flow in 1 second. So number of pulses in 1 second. And pulse duration is the duration for which the pulse is going to last. Now, what is the significance of these two parameters? Pulse duration decides the type of nerve fibers that are going to get activated. So based on the diameter, the ones that have a larger diameter are going to get activated in less duration. They have a lesser threshold for activation, and therefore the pulse duration is going to be low. And when it comes to small diameter nerve fibers, they are going to require a larger pulse duration for activation. They have a higher threshold for activation. Now, which are the larger diameter nerve fibers? A beta fibers. A beta fibers activate the pain gate mechanism, the ones that stimulate the mechanoreceptors. And the small diameter nerve fibers, A delta and C, these are the ones that activate the descending pain suppression mechanism. Now, why is it important to understand all of this? Because each type, each mode is going to have a certain pulse duration, and based on that pulse duration, the nerve fibers are going to get activated, and accordingly that pain mechanism is going to be stimulated. For example, in conventional TENS, the pulse duration is less, and as discussed, the larger diameter nerve fibers, that is the A beta fibers, they have a lower threshold, and those are the ones that get activated in a lesser duration. So whenever the pulse duration is low, they are the ones that are going to get activated. So the pain gate mechanism is activated, and whenever the pain gate mechanism comes into picture, it is helpful in treating cases of acute pain. So whenever the condition is acute, the pain is acute, conventional TENS can be used. Coming to acupuncture TENS, in acupuncture TENS, the pulse duration is large. Now, whenever the pulse duration is large, it is going to stimulate the small diameter nerve fibers, which are the A beta fibers. Now, whenever these fibers are stimulated, the descending pain suppression mechanism is activated, and in this the endogenous opiates are released, which is effective in treating chronic pain. So whenever the condition is chronic, acupuncture TENS is effective. So conventional TENS is usually used in cases of acute pain, and acupuncture TENS is usually used in cases of chronic pain. Now, the frequency. What is the significance of frequency? Frequency decides the type of contraction that takes place. If the frequency is low, there is enough time for contraction and relaxation phase. So the patient is going to experience a proper motor contraction. But if the frequency is large, there is no time for relaxation to take place. So the muscle ideally does not have a proper contraction and relaxation phase. It is just a lot of pulses flowing in every second. Now, with each type of frequency, the sensation that the patient is going to perceive is going to be different. When the frequency is low, the patient is going to actually experience a proper motor contraction, and it is not very comfortable. But when the frequency is high, the patient experiences a tingling sensation which is comparatively comfortable. So now, talking about the significance of frequency in each mode. As discussed, higher frequency is more comfortable for the patient. So in cases of acute pain, higher frequency is used, and in cases of chronic pain, lower frequency is preferred. In conventional TENS, the pulse duration is low, which is going to activate the A beta fibers, which in turn will stimulate the pain gate mechanism, and that is what we want in cases of acute pain, because we need faster pain relief. And the frequency is high, which is tolerable for the patient, which is comfortable in cases of acute pain. So overall, this is how conventional TENS is effective in cases of acute pain. Now, summarizing the acupuncture TENS, in this the pulse duration is longer, which is going to activate the descending pain suppression mechanism, because again that is what we want. We want the release of endogenous opiates for the relief of chronic pain, and the frequency is low because here it is tolerable for the patient. Next type is the burst type, which is a combination of conventional and acupuncture TENS. So the frequency is on the higher side, that is 50 to 100 hertz, and the pulse duration is long. So the mechanism that is going to get activated is the endogenous opiate, and the frequency is higher, so it is going to be comfortable for the patient. So in which cases is burst TENS going to be used? So in cases of chronic pain where low frequency is not tolerable, in those cases burst type of TENS can be used. The last type is brief intense. In this, the frequency is high and the pulse duration is also longer. It works by hyperstimulation analgesia. If I have to explain this in simpler terms, it means desensitizing the pain. This type of TENS gives such a strong sensory stimulus at a high intensity that it dampens all the incoming pain signals. It is used before painful procedures like suture removal or wound dressing, and it can also be used before certain techniques that can be painful for the patient. For example, in frozen shoulder, before giving joint mobilization, the patient can be given brief intense type of TENS, which will for a very short duration desensitize the area.